Trying to conceive can be hard, both physically and emotionally. If you have been trying to conceive for over a year without success, or sooner if you are over 35 years old, you should talk to your gynecologist or fertility specialist and start a fertility checkup. At an early stage of your fertility checkup, your gynecologist will examine the patency of your fallopian tubes. In other words, your gynecologist will examine whether your fallopian tubes are open or blocked. Blocked or damaged fallopian tubes may be one of the reasons you have difficulty conceiving. This condition is what we refer to as fallopian tubal disorder or tubal disorder. The foam procedure, also known as HyFoSy or hysterosalpingo foam sonography in scientific terms, is a new technique to assess fallopian tube patency. Before we dig deep into the foam procedure, let's quickly see what the fallopian tubes are and why it is important to check them. Fallopian tubes are an essential part of a woman's reproductive system. These are the tubal structures that connect the ovaries to the uterus. Open fallopian tubes are important to become pregnant and are the place where sperm and eggs initially meet before an embryo later travels to attach to the uterus. If both of your fallopian tubes are blocked, then sperm and eggs cannot meet, and natural conception will not be possible. At least one patent tube is needed for natural conception. Now that you understand the role of fallopian tubes, let's move on to the foam procedure or HyFoSy. Contrary to the traditional techniques to assess fallopian tubes, the foam procedure is a simple ultrasound procedure that can be done directly at your gynecologist's office. This means no need for an additional appointment at a radiology department or hospitalization. Moreover, the foam procedure is significantly less painful compared to HSG, currently the most used technique to assess fallopian tubes. In short, the foam procedure is a convenient and less painful procedure that does not require surgery, iodine, or radiation. Now, let's see how the procedure is performed. Here is some information you need to know prior to the procedure. The foam procedure should take place in the pre-ovulatory phase of your menstrual cycle, cycle days 6 through 11. This is after the bleeding has stopped, but before ovulation occurs. It's important to have a negative pregnancy test within 24 hours before the procedure takes place. You should eat and drink as normal on the day of the procedure. Prior to the procedure, you will be asked to empty your bladder to ensure optimal visualization. All right, now let's move on into a step-by-step explanation of the procedure. Step 1. You will be asked to lie on your back on the examination table with your feet in stirrups. A routine transvaginal scan is carried out first. Step 2. A speculum is then placed in the vagina. Step 3. A catheter is then gently introduced into the cervix. Step 4. The speculum is removed. Step 5. An ultrasound probe is inserted into the vagina. Step 6. ExEm foam, the medium used for the foam procedure, is gently infused through the catheter and into the uterus and the fallopian tubes. Now, you may wonder what ExEm foam is. It is a medium made of a gel, hydroxyethyl cellulose and glycerol, and purified water. When mixed together, a foam is created. Step 7. The flow of foam can be visualized on the ultrasound screen. Step 8. Patency of the fallopian tubes will be assessed and determined using small movements of the ultrasound probe. If the fallopian tubes are patent, the foam will appear as a thin, bright line within the fallopian tubes and spill over the ovaries. If the white line does not appear, the fallopian tubes might be blocked. Step 9. When completed, the ultrasound probe and catheter are removed. Step 10. Afterwards, you and your gynecologist will discuss together the next steps in your fertility journey. After the procedure, you may notice a small amount of foam discharge and/or spotting. This is normal, and a sanitary pad will be provided if needed. That's all you need to know about the foam procedure, HyFoSy. If any questions, feel free to discuss with your healthcare provider.